Hello, welcome to But Did They Learn? A podcast challenging nurse educators to rethink their approach to nursing curriculum. This is Kelsey, your host and fellow educator. This podcast is meant to be a starting point for educators to engage in discussions around pedagogy and curriculum. So after listening, please engage with other viewers and subscribers in the comments by responding to the prompts and through additional resources on But Did They Learn's community page. All right, without further ado, let's dive into this week's episode, Critical Thinking 101, Going Back to Basics. In episode 1, I discussed 3 harmful norms in nursing education, that our learners and teaching practices have changed in different ways, content and cognitive overload, and fixed mindset curriculum and pedagogical practices. In today's episode, I'm going to talk about the first of those norms, how we can more closely align our teaching practices regarding critical thinking to meet our learners where they are at. Teaching students how to think critically is not something new to nursing education. It underscores our clinical reasoning and clinical judgment processes. Now we have formalized frameworks like Tanner's Clinical Judgment Model, 2006, and the NCSBN's Clinical Judgment and Measurement Model, 2019, alongside the traditional ADPI nursing process that have become standards in nursing education. However, despite these evidence-based frameworks, students still struggle with clinical reasoning and judgment. Why is this? What I've noticed is that students do not have the tools to utilize these processes effectively. What do I mean by this? Well, it goes back to what Dunn and Baker 2025 discuss about how technology has negatively impacted our learners' ability to engage in higher level thinking processes. They struggle to identify and pull important data from content. Instead of engaging in thinking, they want a checklist of tasks or a set of if-then statements to guide their actions and nursing practice. Knowing this, how can we engage students in the critical thinking basics? Today I'm going to discuss 3 ways: practicing problem solving on non-nursing scenarios, modeling the critical thinking process you, as an experienced nurse, go through, and building on our students' strengths. Let's start with practicing problem solving on non-nursing scenarios. This is something one of my fellow educators does that has really stuck with me. They introduce critical thinking to students using an everyday scenario, like having the low fuel light come on your way into clinical. As you work through the decision process an individual might go through to fill up with gas and be late, or potentially run out of gas later, students begin to see these higher level concepts in terms that they are already familiar with and complete on a daily basis. Once these concepts are less abstract, it is easier for students to understand and work within them in more unfamiliar scenarios, like nursing. On my community page, I've linked a TED Ed video about the steps of critical thinking. I encourage you to view it and engage in discussion on ways you might implement it, or other non-nursing critical thinking education scenarios into your own pedagogy. Next, let's talk about modeling our own critical thinking processes. We often ask students to show us their thinking. For example, verbalizing the 6 rights of medication administration. Why? Because we can't see what they are thinking. I don't simply want them to recite the rights. I want to know what they are specifically verifying and therefore verbalizing for each right. But this is a 2-way street. My use of the phrase, "it depends," has become a running joke between me and my students. Recently, when preparing students for a simulation with a postpartum patient, I was asked how long they should massage the fundus. Can you guess my answer? But what is really going through my head when I answer, it depends? I'm assessing, is the fundus firm or boggy, above the U or below? How much lochia is there? I'm asking questions. When did they deliver? Was the placenta intact? What was their QBL? When did they last void? What they see as a token answer is really my in-the-moment application of critical thinking, clinical reasoning, and judgment. But this isn't clear to the students. In order for them to understand this, in order for them to see how to think like a nurse, we need to verbalize our processes. One way my campus has started doing this is voice-over videos. Our simulation and skills team created a video where the nurse walks into the room to perform an assessment. Then, using voiceover, the nurse describes what they were thinking and noticing throughout each phase of the assessment process. Modeling our own critical thinking processes doesn't have to be this formal. We can do this in clinicals, in the classroom, in lab, and during simulation. In Critical Conversations, the NLN Guide for Teaching Thinking, Susan Forners and Mary Fay describe the I saw, I think, I wonder framework for teaching thinking, 2018. This framework allows nurse educators to understand what students are thinking while also sharing their own process from the perspective of an experienced nurse. For more information on the NLN's Guide to Teaching Thinking, please visit my community page. Finally, building on student strengths. We talk a lot about strengths-based nursing, but what about strengths-based teaching? When discussing how we might meet our learners where they are at, it is imperative that we consider what their strengths are and how those strengths might be utilized to improve their learning. So when it comes to critical thinking, what are our students' strengths? When I think of the students currently in my program, I see a strong desire to make a lasting impact. I see learners who know how to overcome adversity. I see empathy and compassion. I see a drive to do their best. I see a generation who understands technology in a completely different manner than I. What strengths do you see? With these strengths in mind, how can we utilize them to help our students succeed, to develop strong clinical reasoning processes that are evidence-based and informed by their own unique nursing identity? My answer? We bring more of them, we bring more of our students into the classroom. We give them opportunities to make an impact. We show them their strength to confront adversity. We highlight their empathy and compassion. We encourage their best and use yet. And we embrace technology. According to the Reinhardt Center for Transformative Teaching and Learning, strengths-based teaching is, and I quote, a learner-centered approach to teaching that helps students identify, articulate, and apply individual skills relevant to their learning needs. End quote, no date. This is much the same as strengths-based nursing, where the patient is the center of our care, and our interventions utilize their strengths to promote their health and well-being. To implement strengths-based teaching, educators embrace 5 principles: assessing student strengths, individualizing learning activities, encouraging student collaboration, creating an ideal environment for students to use and discover strengths, and empowering students to capitalize on their own strengths. Lopez and Lewis, 2009, Reinert, no date. How can we, as nurse educators, embrace and employ these principles? I hope that today's episode gave you a lot to think about. I've only discussed 3 of many ways you could help students understand the basics of critical thinking: practicing problem solving, modeling critical thinking and clinical reasoning, and strengths-based teaching. And while I've discussed some ways I work to address these, I want to hear from you. How do you teach critical thinking basics? What resources do you utilize? Please engage in the comments or on the community page for further resources, including a surprisingly enlightening ChatGPT-generated list of student strengths in their interaction with nursing education. This is Kelsey, your But Did They Learn host. Thank you for tuning in to Episode 2, Critical Thinking 101, Going Back to Basics. Please join the conversation by responding to the prompts below in the comments and on But Did They Learn's community page. I look forward to engaging with you. Tune in next week for Episode 3, Critical Error, Content, and Cognitive Overload.